Good evening. I'm Dr. Robert Peppercorn, and this is the Medical Explorer. As a specialist in skin cancer, cosmetic laser surgery, liposculpture, and allergies, and as host of this program, I will take you on an exploration of the medical communities of our Northern California counties and bring you behind the scenes of medical care practices right here in our local areas. Tonight, the Medical Explorer will take you behind the scenes of a facility that specializes in the care of patients with Alzheimer's disease and dementia. Alzheimer's is a disease which robs the patient of their mental brain capabilities and can be devastating for both the patient and their family. Day-to-day care becomes difficult and can strain everyone involved. The Fremont Rideout Health Group observed the need for a care facility for Alzheimer's patients and developed and built a beautiful facility called the Gardens. This evening, we will take a tour of this wonderful state-of-the-art medical structure in North Yuba City. Tonight, we'll meet the dedicated staff of the Gardens, and it's a great look. In the pharmacy corner this evening, our award-winning neighborhood pharmacist, Bob Church, will discuss aspirin and its potential benefits for heart disease. Does taking an aspirin a day reduce your risk of a future heart attack? Well, we'll learn the answer to this question and others about aspirin and heart disease in tonight's Pharmacy Corner. This evening's program will be extremely timely and informative, and I hope that you'll stay with us for the next half hour. Let's get right into the Pharmacy Corner as we learn the latest up-to-date information on the world of drugs and medications from one of our area's most respected neighborhood pharmacists. Returning tonight in the Pharmacy Corner, as he has for more than 20 years, and it's hard to believe that much time has gone by, is our award-winning pharmacist, Bob Church, from the Medicine Shop in Marysville. Bob, I want to also, besides getting into our topic, congratulate you on the expansion of your pharmacy. You've done some big things over there.
Well, actually, we were lucky to have some space next to where we were come available, and so we decided to take advantage of it, and it's turned out very, very nice, and we were really enjoying it.
What kinds of things have you added in?
Well, we added a bigger lobby for our customers. We added more workspace for us so that we had individual workstations instead of being all crowded together.
Oh, wow.
We have a bigger consultation room, an actual room now, instead of just like a little protected area. We actually have a room for consultation now.
Wow.
We have more office space, nicer break room for our employees, and we're able to do a lot of things that we hadn't been able to do in the past.
You didn't put a TV studio in or anything like that?
Not yet, but
okay.
You know.
Maybe someday we'll do that, yeah. Well, let's get into, actually, that's a great subject for a Medical Explorer program, so we're going to set that up, I think. Come over and take a look at your pharmacy. That would be great. Great. What's the current thinking regarding aspirin as it relates to coronary heart disease?
Well, there's actually probably three important points. It's unquestionable that the use of aspirin for those who have a history of coronary heart disease will help prevent future cardiovascular events such as heart attack. It's sort of questionable. In other words, some clinicians still have doubt as to the benefit for people who have no history of coronary heart disease. Now, that being said, there are several large studies which have shown that there is a significant benefit in reducing the risk of first coronary event for people who have sufficient risk factors. Now, the risk factors, it's interesting. I found actually, and I don't have the websites with me, but people could call me and I can get them for them. There are actual websites now where you can go and determine for yourself what your risk factor for cardiovascular disease is, which might be helpful when you talk to your physician about it, you know, and they do studies and workups on you if you sort of educate yourself. But there's a way to do that now.
So risk factors would be smoking, family history,
Absolutely.
being too
Diabetes.
heavy, diabetes.
Sure.
Interesting, yeah.
Oh, yeah.
What are the current recommendations across the country for aspirin use?
Well, the last official recommendations that came out were in June 2002, and they say that if you have a 3% chance or more of having a major cardiovascular event within the next 5 years, you should consider using aspirin on a daily basis. It's normally recommended for people, men who are over the age of 40, postmenopausal women, people with diabetes, smokers, people who have a history of coronary heart disease in their family.
Is there a thinking that it might even prevent general atherosclerosis in the body, the plugging of vessels or things?
Yes, there is, absolutely.
Because a lot of people now are having these CAT scans done to look at calcium in the heart. They're like screening tests.
Yes.
And they see little lines of calcium that suggest they may in the future have trouble. Maybe they should be taking it,
Well,
we don't know for sure, but maybe.
You're right, we don't know for sure, but it's sort of the evidence sort of makes you want to lean in that direction.
When I see patients every day and do little surgical procedures for skin cancer or take off moles, and they're taking a little bit of aspirin, you really can see a difference in the way their blood will clot when we have to cut them. It doesn't interfere with the procedure because we're prepared for it, but you really can see the effect on the flow of their blood as you touch the skin. Yeah.
That is interesting.
And I even started, I'm 50 years old this year, don't tell anybody that, of course, and I take a half a baby aspirin a day. I know that's a tiny amount, but I say, why not just do that,
Yeah.
So.
No.
But what is the actual dosage recommendation for someone that really is statistically trying to work on this?
Well, it's changed a little bit. I can remember years ago it was 325 milligrams.
That's a regular aspirin
tablet.
tablet.
A regular aspirin tablet, yes. And now the recommendation is anywhere from 75 to 160, and quite frankly, what's really happening is the 81 milligram or the adult low-strength aspirin, which is the same as the baby aspirin.
Well, that's about 81 milligrams?
Yeah,
okay.
But they got away from the term baby aspirin because we don't want babies to take aspirin,
Oh, yeah, well, that's
because
interesting.
of the Reye syndrome thing. So they've renamed that to adult low strength.
I'm too old, Bob. It goes back too many years. Okay, thank you for correcting me on that one. Good. So would you say then the 81 milligram is the usual now?
That's the usual dose now.
And not the full tablet of 300 and so milligrams each day. Interesting.
Yeah.
When is it not appropriate to use the aspirin?
Well, as you and I both know, that when you take aspirin, there is an increased risk for GI bleed or intracranial bleed, and that would certainly depend upon the person. But I would say that anybody who has had a history of a GI bleed or hemorrhagic stroke should not be using aspirin unless they're specifically told to by their physician, or anybody who is allergic to aspirin or any of the salicylates. And then there's a group of people who are taking like non-steroidal anti-inflammatory drugs or an antiplatelet drug like Plavix, which I term a super aspirin, or the blood thinner warfarin, Coumadin. Those people should be under close medical supervision if they're going to be taking aspirin.
So let's say someone taking over-the-counter Motrin or Advil, would you suggest they be careful in taking it or discuss it with their doctor first? Or?
Yes, I would, and the reason well, there's actually a couple of reasons. Usually people who are taking those drugs, whether they be over-the-counter or prescribed, are taking them for a protracted period of time. Let's say they've got arthritis, so they're taking them every day. If they're taking an aspirin tablet every day too, that non-steroidal drug can negate or nullify the effects of the aspirin. So what we're finding is it's not really, we're not saying don't take them together. What we're saying is the timing is critical. Take your aspirin first, take your non-steroidal 2 to 3 hours later, and then they both work.
Well, that's sort of interesting because that must be pretty new information. They actually
Probably within the last year or so, yeah.
They actually are somehow negating each other? I mean, so you
Yes.
might not get the beneficial
You wouldn't be
effects
getting the benefit of the aspirin if you take them concurrently, but if you separate them, 2 to 3
There's
hours.
some stomach interaction or something. That's interesting. Now, would they get benefit for their blood vessels and heart disease from Motrin or ibuprofen? Do those have the aspirin effects of that? Is that
No, they really don't. They can have some blood thinning properties, but it's not as dramatic as with the aspirin.
Now, you used to talk a lot about bufferin and buffered aspirin. Is that still an issue of one type versus another? And
It's not really. What we're trying to get people to do is take the enteric-coated aspirin product,
enteric-coated, okay.
so that instead of dissolving in the stomach, it dissolves in the bowel, and they don't have to worry about the stomach involvement, the stomach upset, the nausea, the GI bleed.
Is there an enteric-coated 81 milligram aspirin?
Absolutely. In fact, that's the only one that we sell.
Ah.
Yeah.
And they can just walk in the pharmacy and you'll point out which one they need?
Absolutely.
Great.
Absolutely.
Well, why don't we just summarize the issue of aspirin and coronary heart disease? What do you think?
What I think is that it's a safe and effective way to help prevent you from having coronary events, providing that you are cautious, and we've alluded to some of the things that people need to key in on. There was an interesting study that was done that had 26,000 people involved in it, and I think it really tells a story about what's going on. Only 8% of those people who had no coronary heart disease history were using it for primary prevention. Only half of those who had coronary heart disease history were using it to prevent them from having a secondary problem, which tells me that there is an extreme need for patient information regarding aspirin and coronary heart disease.
Yeah. I'm seeing, though, a gradual increase in the number of people coming in that are taking it. So I think that the word's getting out there more.
It may be.
It is.
Yeah.
Right. Well, Bob, as usual, that was very important and helpful information, and I hope that our viewers will discuss their concerns about aspirin and its possible use for the prevention of coronary heart disease. As I said, you know, I even take it. And they can discuss this with their pharmacists and personal physicians when they get their next opportunity. Bob, we certainly look forward to you returning on future programs.
Thank you.
You.
You bet.
Now on with the Medical Explorer. I've been impressed over the past 2 decades watching Fremont and Rideout Health Group build more and more facilities in our community. We have the Heart Surgery Center, we have new buildings in Yuba City, the new Rideout building, we have facilities, skilled nursing care facilities. But one of the most interesting and not really discussed building is their Gardens facility in North Yuba City. This facility is off of Gray Avenue, just north of the Yuba City Mall. And let's go over and take a look at the Gardens, just a short drive from here. Let's take a look.
Hi, Dr. Peppercorn. I'm Chris Parker. I'm the Division Administrator of Senior Services for Fremont Rideout Health Group, and I want to welcome you to the Gardens Alzheimer's Unit.
Well, it's a pleasure to be here. Could you tell us a little about the history of the development of this Gardens?
What we've done over the past 13 years is we started with a skilled nursing facility, the Fountains, back in 1990. We developed that and started that up. Back in 1998, we started up the Courtyard Assisted Living Facility. And as of the start of 2003, we started up the Gardens Alzheimer's Unit, and then we're looking into the future of expanding into more senior services with an independent living facility.
Well, what I'd like to really see now is this facility, the Gardens, and you have the manager ready to show us?
Absolutely. I'd like
Can you introduce me?
Introduce you to Lori Kelly, our facility manager.
Nice to meet you.
Nice to meet you, Dr. Peppercorn.
Can we take a little tour and look around?
Sure. Come on this way.
All right. Great. What is this little space right here?
This is one of our entry sitting areas. A lot of times the families come and can enjoy visiting with their families here if the weather doesn't permit outside to go to our inner garden area.
I notice you have the clothes hanging here. Is that more of decoration, or are those real hats and ties of somebody?
You know, they did belong to a resident originally at the Courtyard that we were very attached to, and the family was wonderful and donated them to us to use here.
Looks nice.
Yeah.
Well, what's down the hall? Let's head down
We'll
there.
go down this way. This is our sitting area where our receptionist is. Off to the side here is our medication room. That's where all the residents' medications are kept locked and distributed according to the physician's orders.
Great.
And we have our dining room area here and our own kitchen. That's where we prepare all of our meals.
Well, let's go into the dining room.
Okay, we can do that.
So tell us a little about the way meals are prepared and how it all works out here, if you could.
Okay, sure. We have 3 meals a day, of course, in between snacks. When the residents come in, we get a lot of input from the families on favorite meals, things they grew up on, things they especially enjoy. We always work that in our menu plan. And especially the snacks, too. We make sure we have all those on hand. They're prepared by Vicki and Mandy, who are our cooks.
I see you have one of your staff working with a resident. Can we go and take a look?
Sure. Right now, Susie is visiting with Eva, one of our residents here, and a lot of times we're able to do a lot of one-on-one. Eva was a school teacher, so we like to read with her, and she is very informative to us on history, things that she's lived and times that she's been in. So that's what they're doing at this time.
Let's take a look out here, see what we have.
Okay. This is another one of our sitting areas. This gets used quite a bit because it's outside of our dining room. And it also has a TV, so a lot of the residents choose to stay here, and quite a few on the inner patio here. That's one of our more popular areas, too.
That looks so comfortable. I think I'd like to come over here at lunch and sit down and watch TV over with you.
You know, I think we'd let you.
Oh, thanks. Let's go and see some of those activities.
Okay.
Well, I see we're in an interesting activity right now. You have birds singing in the background, the residents doing things, I guess a staff person instructing. What's happening?
It looks like Emma is doing some chair aerobics with the residents. She has a schedule made up as a calendar for a month at a time, and it is kind of how she plans her day as the birds are chirping in the background. The residents also help in assisting with pet care. A few of our residents have cats, as well as they assist with the birds, too.
What other kinds of activities might take place in this room?
You know, we do a lot as we go down the hall. You'll see that there's a wreath on their doors. They do gift items for their families. They color pictures. We do crossword puzzles. We watch some old movies. We do a lot of dance here. The residents really love to the music and to participate with that. We do have some people that participate and come in and play the piano, as well as one of the residents here plays. And so they can get live music as well as that on TV or by CD.
Now, if a resident decides they don't want to participate in activity, they don't have to?
Oh, no, they're never forced to. We do encourage them. Once they get started, they seem to really enjoy it. We also do go out to lunch occasionally and do Dairy Queen runs, so they have a lot of fun participating in all the food programs especially.
What happens when a resident has to go to a doctor's appointment or something outside the facility?
You know, sometimes the family likes to do the transporting, and that's fine. Sometimes they want to meet us there, and we transport them with our van, and that's fine. Sometimes they say, you just go ahead and transport them and give us a call and let us know.